BSI, things like Melanie Walker, LDCC paramedic program, and I will do a medical patient assessment on pediatric
Oh,
patient.
shit, I'm actually
Patient
good.
said to be approximately 92 years old, female patient. I'm going to approach my patient, and my general impression of the patient is she's nice colored, seems to be happy-go-lucky, no major issues, no effort in breathing and all that good stuff. Patient, hi, my name's Melanie, and when she speaks, don't note any foul odor or breath or anything like that. I'll go ahead and get my baseline set of vitals for my patient, check her blood pressure, respiration rate, and I'll check her pulses. I'll check her brachial pulse, her radial pulses, and her carotid pulses. And once we do that, and once we know those all in normal range, I'll just begin general conversation with the patient, ask her her name, to make sure that she knows who she is, knows where she is, whose she is. That alerts the patient to person, place, and thing. Also, while doing that, I could also test the patient's memory status for long-term and short-term by asking her, what did you have for breakfast this morning? Or a simple question like, what color shoes are you wearing, without letting her look. And then we'll move on with the assessment, and after we check her vital signs, just a quick assessment of her head. While I'm assessing her head, I'd also check her temperature, with her permission, of course. Assessing her hair, making sure that her scalp is clean, no bugs, no scrape scars, assisting checking her facial bones, and palpating, make sure there's no deformities or bruising. I'll check her ears for any type of leakage or excess buildup of any type. I'll assess up under her chin, ask her to say ah, check inside her mouth, check her teeth, gums, everything. Moving on down, I'll check her shoulders, and with her permission, I'd also take and listen to her heart tones. And while I have her shirt elevated, listening for her heart tones, I would assess for any type of bruising, any type of abuse, any type of rashes or bumps, bruises, anything like that. I'll listening for S1 and S2 on her heart sounds. Everything sounds normal. I'll go ahead and move around to the back, checking her skin and back area for the same bruising and so on. Also auscultating her lung fields, making sure that her breath sounds are clear in all four portions of the lung. Just moving on down her head, neck, scalp, excuse me, her shoulders, her arms, ears, nose. I will check her nose. I forgot that part. For any deformity or any kind of leaking or anything like that. I will check her neck to make sure that her trachea is midline and that there is no JVD. Also, like I said, when I check her chest area, make sure her skin color is good, nothing there. Also auscultated her lungs, listen to her heart. Okay, I move on down and check her abdomen. Check the color of her abdomen, make sure that there's no tenderness or rigidity or tenderness while I'm palpating. Also making sure that it is of normal size for her age, that there are no lumps, no bumps, good. No scars. Also, we would go on down to her pelvis, maybe just get her to stand up to make sure she doesn't grimace with any pain. And while she's standing, I would note the length and size of her legs, make sure that they are okay. Have her sit back down. That shows me stability in her pelvic area because she did it with no grimacing. With parental permission and observation, I would ask to check her genitalia, make sure that there is no discharge, no bruising, or any kind of tearing, scars, or anything on her private area. We move from there, and I would check her range of motion in her legs. I'd ask her to flex her legs out and pull them back in, push down against my feet, pull up against excuse me, push down against my hands, pull up against my hands. Also, I'd ask her to grab my hands with her, you know, and stretch one arm out and push them apart, pull them in. And once I've finished her head to toe assessment, I would check her femoral pulses here and here, and also here. I'm done with this section.